here we are with Angela Myers.
Angela has over 38 years of experience in the medical field, including emergency, surgical, forensic, home health care, and psychiatric medicine. She is a certified expert witness as a sexual assault nurse examiner and assisted in writing the same program for the refugee house and the child protection team of Tallahassee. She's been a teacher at Brunel College and a speaker on subjects such as Lyme disease and women's health care.
What made you start this practice and do this after all the experience you've had before?
I started this practice because I was diagnosed with rheumatoid arthritis back in the 1980s. I went to my rheumatologist. I said, well, what can you do to get me better? And he said, oh, we can't do anything. He says, you're going to end up in a wheelchair. You're going to end up with joint replacements. And I just looked at him and I said, oh, no, I'm not. And so I started researching on my own, and I found the Road Less Traveled book, and it was about doing alternative therapy for rheumatoid arthritis. And so I worked with one of my peers who ordered me minocycline, and I started taking the minocycline. And oh my gosh, I thought I was going to die because my hands started swelling up. My joints started swelling up, and I said, I'm just bear through this. That was called a Herxheimer reaction, I found out later. And after about a year and a half, I was fine. So I went off of the antibiotic, and I really have I have a little curvature in my thumb. I don't know if you can see it. Both of them a little bit. And that's the only thing that I have.
And you're not in a wheelchair.
Yeah, I'm not in a wheelchair, and I'm doing fine. Then I started working in a clinic, and I started treating bacterial vaginosis with diet. And
which sounds
because what
different.
I noticed is I would treat them with metronidazole, and then they would come back again, and they had bacterial vaginosis, and that's a vaginal infection. And so I started treating them with a higher protein, lower carbohydrate, no sugar diet. And guess what? They got better. But then guess what? I got reprimanded because I didn't follow the food pyramid. And guess what? It's changed. They're recommending higher protein now. So, it just brought me to the realization, and I was so blessed for this, that I needed to do things differently. And I needed to look at people individually.
Awesome.
And look at their diets, look at the way they were living. And so that's how I got started. I think it's like 21 years ago.
Oh, wow.
In my clinic.
But you're a nurse practitioner, and most nurse practitioners do not open a practice. You went to a higher level. So how could you do this?
What really pushes me to go forward is I love helping people, because you know what? I've been on the other side, and I know what that's about.
What pushed you to Lyme disease, which is another very gray area of the medicine, and especially here that it's been so neglected that we are not being treated, that they say Lyme disease does not exist, and they say there's no chronic Lyme. So many difficulties. Why would you take such a challenge of getting into the hardest part of medicine, which is treating patients with Lyme disease?
At that time, 21 years ago, people with Lyme didn't really have a whole lot of hope and didn't have a whole lot of options.
Nothing.
And so, again, I related back to my situation. So, I thought, we're going to get these folks well.
What have you learned about treating Lyme from that time to now? What resources you have that you didn't have at that time?
I have met Dr. Klinghardt. I follow him. A lot of different folks in the Lyme field. Horowitz. There's just a lot of folks out there that are doing good work. And we all share.
What can you offer to people with Lyme disease?
We offer a lot. We just offer so many things here. Eric actually does the QXCI or SCIO. It's a form of energy medicine, and it actually does an energetic scan that sends over 9,000 electromagnetic frequencies into the body that reacts with amperage and voltage, and that comes back into the computer, and it calculates. It can look at the energy signatures of toxicities, of pathogens, of hormones, of anything, 9,000 things, a lot. The other thing the SKIO does is it actually treats your energy field. So it normalizes the energy field. So not only do we get a readout of where your health is energetically, he gets to treat you. And when I talk about a readout energetically, you all just need to understand our bodies are energetic. That is the basis of our health, is our energy field. We have to keep that energy field really, really tweaked. That's what our cells and everything listens to. So he's been a big, big help. So then, I do homeopathy. That's energy medicine. Every time you dilute a vitamin or mineral or whatever it is, you create an energy pattern. So you've probably seen like a 10x, a 20x, a 30x of whatever it is, like rickettsia. Each one of those dilutions create an energy pattern. And that energy pattern signals your body to heal itself. It helps your body heal itself.
Wow.
I do Chinese herbs and vitamins and supplements because most people that have chronic illness, and I include Lyme into chronic illness, their functional body's not working very well. And so we have to get the functional body working. And we use also vitamins, nutrients, foods, that kind of stuff. We have an infusion center. We do all kinds of infusions. We do IV MAH or IV ozone, and I did train and get certified with Dr. Schallenberger. We do prolozone injections, which are prolo plus ozone. Really helps joint pain, just all kinds of things.
Resources that you didn't have before.
Yeah, no, we didn't have any of those resources before.
How would you describe what is Lyme disease?
Lyme disease is a very individualized disease. It can be very chronic, and I do think that it's caused by ticks, fleas, mosquitoes, bugs that can give you blood exposures, and it's transmitted that way. There are some other speculations about transmission, but
from the mother to a child is
mother to a child. There's some speculations it's sexually transmitted. Mm-hmm. There's still a lot we don't know. We know a lot more than we've ever known, though, I will say that. Lyme disease affects everybody differently, and that has to do with your toxic exposure, your condition of your immune system, your genetics. If there's other pathogens involved, I see a lot of other viral infections with that, particularly Epstein-Barr, which has a lot of different species, some resistant, some not.
Would you agree with me that it's a combination of many infections? Because the books say it is only the Borrelia and that it's been treated with 2 weeks of doxycycline and that's it. And then even doctors state that if you're sick longer than that, it's your problem. It's like Lyme has been already treated and you don't have a chronic Lyme, all that thing. So would you think that it's really something much more complicated than what the books traditionally state?
It's very complicated, and there is always more than one pathogen that is causing problems. It could be parasitic, it could be viral, bacterial, a lot of different co-infections. And what I've found is that the sicker the person, there seems to be a higher incidence of co-infections.
So many don't understand co-infections. Co-infections will be having the Borrelia, which is the main, and then another amount of infection.
Yeah, there's different kinds of infections. So let's say the Borrelia is your highest pathogen load and you're seeing the symptoms of Borrelia. Well, there's usually other symptoms of like say Babesia infection, but it's on a lower pathogenic level. Other viral infections that are lower pathogenic level. And it's like it's like unpeeling an onion. And it doesn't you don't just treat one thing. That's for sure.
And what do you think about the guidelines for treating Lyme disease?
I think that people are generally more immune compromised right now, and we're actually seeing this in medicine, where we are actually having to treat sinus infections longer, we're having to treat lung infections longer, and I do believe that it has to do with several components, one being people are more immunocompromised, and the pathogens that we're seeing probably are a little bit more pathogenic, and so you do have to treat Lyme sometimes for long periods of time.
Lots of people from the Lyme community come to see you. What's your message for the people that are there hopeless, feeling that there's no cure, feeling that there are not enough treatments to recover?
Well, this is what I want to say. In this period of time in our life, our minds are very, very powerful. And we all have to believe and see what we want our health to be. So first of all, you have to believe from your heart. And I'm not talking about from your mind. I'm talking about from your heart, with your mind, that you are going to be better. Because you know what? I know you will. And you cannot give up. Just because one thing doesn't work, there's so many other things out there. And remember, health is really very individual. And it's different for different people. And just remember, one size doesn't fit all, but you also need to keep that positive thought and those positive words. And I will tell you can ask some of my patients, I will tell them to get a picture of when they were the healthiest ever and put it up in their mirror every morning where they go and brush their teeth or do their face or whatever they do so that they can see that. Because that's the real them. And you have to believe it, you have to see it, and you have to say it. Because that's energy that you're feeding your body. So, I don't know. I think that's...
Thank you, Angela.
Is that about it?
About it. Wonderful. Is there something else you want to say or that you feel is important in the Lyme community or the chronic people? Because this is for chronic diseases, invisible diseases, and that's our idea, to help and educate. Is there something you would like to say?
Yeah. One other thing I'd like to say is that we all need to really live and experience the healing frequencies in our life. And what are those? It's love, it's joy, it's happiness. It is not anxiety, it is not fear, it is not anger. But remember, the healing frequencies are love is the highest, joy, and just being happy and having fun and laughing and just, be happy.
Thank you so much. But I just opened a page because my mom always said, you open up the book, we'll talk to you. And I just opened it and it says, the healing powers, love, joy, and
Happiness, yeah.
Just that.
Yeah.
Same message.
Those kind of messages, when you see them, that's the way God speaks to us, is through messages that are repetitive. Because He really wants us to get it.
And we're so dumb.
I could go into that too, but I want to leave on a happy note.
I'm going to record my helper too. Gracias, Orla. Angela, gracias. Thank you.
Thank you for being involved with Lyme and doing everything that you've done. You're so blessed.